Well, I mean, we had a family member who had a medical condition. It was a cardiac condition, and sort of we were introduced to it young, just kind of going to doctors and kind of hearing terms at home. So this sort of intrigued my interest, and gradually my interest grew as I studied sort of biology in school, and then going into college, studying more of human physiology. So that was sort of the seed that started the whole process. Gradually, as I studied cardiology in college, in human physiology, it triggered my interest more. And when I went into med school, I obviously, kept an open mind and tried different fields. But I always found that I always returned to cardiology, that I enjoyed it the most. I liked the fact that it was a combination of not only medication, but also a lot of mechanics and a lot of physiology. So it was a very inclusive field that I sort of was able to put together a lot easier. I definitely want patients to know that I'm very respectful and respecting of patients' care, privacy, their feelings, their reservations, their fears. Anybody who's who's ever been a patient, which essentially most of us have been patients at some point in time, definitely want somebody who's caring. Two, you always want somebody to be knowledgeable, to know that they can trust you, and to know that you'll do the best for them. And I will always do what's best for my patients. And if there's something that I don't feel that I know best, I will make sure that they get the best care under any circumstances. I think listening is extremely important. I think if you just listen to patients, you will know, you'll be able to diagnose them a lot easier. You will hear what their true concerns are. You probably will do less testing because you'll be able to hone in on the problem a lot easier and a lot sooner. And most patients very, very often know what's wrong with them, and they're able to tell you in so many ways. And once you listen to them, you're able to order the right testing or diagnose the problem a lot quicker. So trust is definitely something you earn, right? I mean, it doesn't, for the person that sees me for the first time, I think they want to be trusting, but I think they certainly I need to earn their trust. I think just by being sincere, being honest, telling them the findings honestly, simplifying your language, make sure that we use layman's terms so they can understand what I am saying, what medicines they're taking, why are they taking it, the importance of taking it, any potential side effects, any testing that we do, for example, all the risks, all the benefit. So I think being humble and using layman's term, explaining everything in detail, and being honest with the patient, hopefully they trust you. We have a growing family. We have twins, and we have a newborn, so we spend a lot of time at home. We love to explore all the local activities in Wichita. They have, the zoo. We've been there. We have an annual membership to the zoo. We have, membership at the local gardens, and so we, do a lot of outings, a lot of exploration of the local activities with our children. We travel when possible, but a lot of time is family-based. I personally try to lead by example. So I try to wake up early before work and go to the gym, take that time for myself and for my health, and so that when I advise patients to exercise, I'm leading by example. So that's mostly family and just trying to stay healthy.